Hello and welcome back to part 6 of this series, Staying Healthy and Preventing COVID-19 Infection During the Current Epidemic. Indeed, the COVID-19 is a public health crisis and not a military crisis. Therefore, taking action purely based on military strategies such as 24-hour curfews is not going to be helpful neither to the people or controlling the disease by itself. Instead of indefinitely locking up countries or provinces, strategies should be developed to enhance markedly the testing and diagnosis people with the disease, not only in the hospital setup but also more importantly quarantine facilities and indeed in certain circumstances in the community. So, so despite the stringent curfews and locking down cities, there's no way one could identify people with the disease and put them in the quarantine centers and treat them. Testing is the answer. So look at the sensible plans implemented by the other countries such as South Korea, now Japan and Germany and Singapore. They relaxed their social tightening, like locking down the country fairly early, but they markedly increased testing facilities. Some countries testing about 15 to 20,000 people each day, whereas other countries testing 50 a day, which is insignificant. So putting their resources at the right place is the way to move ahead of this crisis. If you don't have enough kits, import them because that investment is worth it. Since COVID-19 is a highly infectious disease, everyone suspects of having a disease based on A. Clinical symptomatology, B. Based on exposure to person with COVID-19, C. Are in incubation period by clinically or otherwise, and right within the previous 2 weeks for the country or a region are candidates for humane quarantine and strict isolation. Nevertheless, all of them must be tested prior to discharging from these centers. In person without signs and symptoms, no physician can confirm through clinical examination or history whether that person have COVID-19 or not. Testing is the only way to confirm whether a person having the disease or not. Even the testing is not 100% foolproof. There are about 20 to 25% of the patients may not be positive on the first test, and this patient is essential to repeat them a couple of days later. So to re-emphasize that the testing is the only way to confirm whether the patient is having the disease or free of disease. Failure of doing so is unwise and it can lead to further outbreaks. Those having a positive test or highly suspicious having the disease should be strictly quarantined or isolated in protective appropriate places without exposure to others or themselves to other people having the disease. This is essential as a test may not be positive for a few days and not everyone exposed will get the disease either. So this we briefly discussed in the previous video. So the last thing one wants to do is to otherwise healthy people deliberately exposing to people with the disease in quarantine centers that markedly increase their chances of contracting the disease. This is highly unethical. Test negative but exposure positive people should still be in quarantine because they can develop these antigen antibodies later depending on their own immunity status. Persons who are less suspicious and have not had direct exposure or contact with a patient of having the disease could be managed with strict self-quarantine at their home, but with the daily guidance and supervision of the local public health inspector, the PHIs mostly, and the medical officer of health in these circumstances. So what is to be expected? Relying only on curfews or to overcome the pandemic is unwise. Several other strategic measures and approaches must be implemented in parallel, irrespective of the cost, specifically increasing the testing by probably 50 to 100 fold. In the absence, it is possible to have a major secondary wave infections and multiple outbreaks, and people are likely to lose trust with the government as well as increasing incidence and death rates. Unfortunately, this is already happening in some areas. Thank you for participating, and we'll see you on the video 6. Bye.